I don't think I'm interested in implants. I don't like the idea of rods in my arm.
It doesn't sound very comfortable.
And I can't have a sore arm even for a few days because I need to carry my children, cook food, and do the shopping.
I can help.
Thank you, dear. But you are not much of a housekeeper or a cook.
That's true.
Besides, you are away at work. I would like to have the IUD.
As she wishes.
Make sure the client knows about all appropriate IUD options.
There are two types of IUDs. One uses copper, which changes the quality of the mucus and fluids in the uterus so that the sperm doesn't reach the egg. The other IUD has a hormone which is released locally in the uterus to prevent pregnancy. A small percentage of women spontaneously expel the IUD within the first year of insertion. Occasionally, they don't even know it has happened. If you feel the hard plastic of the IUD in the vagina, please come back to the clinic and have it checked.
Caution the clients about perforation of the uterus.
One additional word of caution. While healthcare providers are very careful, on rare occasions, the IUD may perforate the uterus during insertion. This happens to less than 1 in 1,000 women, and the perforation usually heals on its own.
That is good to know, but it does not sound like much of a risk.
Encourage your clients to ask questions.
Any questions so far?
Since the IUD stays in me for so long, how will I be sure that it is still there?
The IUD has 2 strings that hang into the vagina. Once a month, you will need to feel the strings. If you feel them, you know the IUD is still in place. It's not difficult. I will teach you how to do this.
Will those strings bother me and my husband when we are having sexual relations?
I was going to ask the same question.
They should not be a bother. But if they are, you can come back to the clinic and have the IUD strings checked.
What if we decide we don't want the IUD anymore?
Reassure the clients that the IUD can be removed at any time for any reason.
We can take it out very quickly and easily, and there's no delay in a return to fertility as soon as the IUD is removed.
That is good to know.
Counsel them about the insertion procedure.
This is the copper IUD. And this is the part we use to insert it into the uterus. The IUD will go in this inserter and slowly pass through your cervix into your uterus.
Does it hurt?
She will feel some discomfort and cramping, but nothing too severe.
I hope not.
Would you like to have the IUD inserted today?
If you feel this is the best option.
Yes, I would like to have the IUD today.
Would you like the copper one that lasts for 10 years or the IUD with the hormone?
I would like the copper IUD. I like the idea of something that lasts for so long.
Explain the next steps.
I will start with a pelvic exam, and if all goes well, I will insert the IUD.
Do you need me here during the procedure?
Only if Auntie Albina wants you to stay.
I will be fine.
Very well then. I will wait for you until you are finished.
Make yourself comfortable in our waiting room.
Thank you.
Before we begin, you have to empty your bladder. Do you remember where the washroom is?
Yes.
Take your time and come back here when you're done.
Okay.